So I'm Karen Payne, I'm the Clinical Skills Facilitator here at the Innovation Centre. So we offer simulation-based education. It's based on scenarios. So we get people to immerse themselves in real life situations. So we write scenarios about all different kinds of situations that health and social care workers find themselves in. The benefits of simulation-based education is that the delegates can practice real life situations that they find themselves every day, and they can make their mistakes here. So they don't have to practice and work through the mistakes that they might make on real life patients. And we do that in a safe environment, and then we talk about it afterwards in our debrief and look at how we can improve that and care and quality going forward. So as part of the simulation-based education, we're able to offer different aspects to bring learning to life. So we use a GERT suit, and that's putting on a suit that simulates old age and what it's like to have glaucoma, things wrong with your eyes, no hearing, what it'd be like to be arthritic. So people can look at that and put those suits on and they have that situation. We have virtual reality headsets, so you can see what it's like to live with diabetes and have a hypo. You can see what it's like to live with dementia, and we're looking to develop many more virtual reality experiences. As well as doing that, we have a lot of equipment that people can look at to see how it support them, so digital equipment. And then we also offer a lot of immersive gamifications. We run ESTER programs, so that's what matters to Esther. So that's all about personalised care, and we thread that through all of the training that we do. So for example, if we do our dementia day, which we don't do any PowerPoints, so we do lots of games, we do care planning, and we do lots of scenarios. So we can bring this simulation-based education out to practices. It's really beneficial to have it in the place where you actually work, and we can practice those real-life situations and bring in the multidisciplinary team to all train together. So that's a huge benefit of doing the simulation-based education as an entirety. And you also get to make mistakes in that environment and to come up with different strategies, ideas, and innovative ways of working going forward.